Lots of people will be buying or trying to buy paracetamol these days, as it's very effective for treating pain and bringing down a temperature, but taking too much can cause serious problems. The usual dose for adults is 1 or 2 500mg tablets up to 4 times in 24 hours. Anything more than that is too much. Unfortunately, overdoses do occur, and a single acute overdose, typically done intentionally, is considered as more than 4 grams in under an hour, which can be highly toxic for the liver. Paracetamol overdose is the leading cause of liver damage in Europe and the US, and 80,000 people are hospitalized each year for it. The good news is, the current treatment for paracetamol overdose, called NAC, is very effective, but a group from Chapel Hill University in the US have announced a molecule that is more effective than the current treatment when administered in mice 3 hours after the overdose. I am Melanie Jansing, and I spoke with Christophe Gaunt, a clinical scientist from Cambridge University, who wasn't involved in the study, to find out more.
This compound is able to stop the selective damage caused by paracetamol. So that's the activation of this protein pathway. So it's able to specifically stop paracetamol damage, as opposed to the other therapy, which regenerates your stores of this enzyme that is able to aid in kind of reducing the toxic metabolite, but on a very higher level.
The damage that Christophe is referring to is an inflammatory pathway that makes the initial liver injury worse. To understand this, let's take a step back and look at what happens to a paracetamol in the body. As paracetamol is broken down by the body, a series of chemical reactions take place, and one result is a toxic intermediate state called NAPQI. If you take an appropriate amount of paracetamol, the toxic intermediary is soon further converted into harmless chemicals with the help of a key enzyme. But when you take an overdose of paracetamol, the stores of this enzyme get depleted.
In toxicity, these mechanisms, which are normally very effective at removing the paracetamol from the bloodstream, become overwhelmed. And when these become overwhelmed, the remaining paracetamol is shunted down a different pathway, involving another family of enzymes that are less efficient and results in the production of a toxic compound from the original paracetamol. And just the name for reference is NAPQI of this toxic compound. And when I say it's become overwhelmed, normally the enzyme that is responsible for breaking down, so the enzyme is a protein that causes change in these molecules, the enzyme glutathione itself becomes overwhelmed and depleted, and your body cannot produce enough of this enzyme and therefore isn't able to break down this more excessive NAPQI that you now have because you've taken too much paracetamol.
The standard treatment, called NAC, works on restocking the body's shelves of this glutathione enzyme that converts the toxic intermediary into something safer. It does a good job, but the timing is crucial.
Any longer than 8 hours after you've had a paracetamol overdose, you can set off a chain of kind of reactions, resulting in some liver damage, although if you're 9 hours rather than 8, the damage will obviously be far less than if you're 24 hours rather than 9 hours.
Instead of replenishing the enzymes that break down NAPQI, the new treatment combats the damage that NAPQI is doing to the liver cells. It works to neutralize the inflammatory action of a protein that's released from the injured liver cells which have been poisoned by NAPQI. 3 hours after taking a lethal amount of paracetamol in mice, the new treatment showed lower levels of a chemical which indicates the liver damage than with the current treatment. The time frame that this new treatment could work in remains to be determined, so more work is needed. But if it is shown to be effective in humans, and better than the current treatment at other time points, scientists are hopeful that this drug could provide a potential approach to treating late-presenting patients with paracetamol overdose.
One could imagine that there could be some kind of dual therapy where it would be quite useful to have both, because, we already know that the older therapy is an established therapy. We know it's safe, and we know it's effective, most importantly. So if this could be given in conjunction with that, you could see potentially a better recovery in patients from paracetamol overdose.
But many of us take paracetamol frequently. After all, in the right doses, it's a very useful drug.
A small amount of paracetamol overdose is nothing to be worried about. I think just drink plenty of water, consult your healthcare practitioner. These medications are not really for this setting. It's mainly concerned with those who have a very severe overdose, and that may be seen most commonly in patients who have a deliberate overdose of paracetamol. It would be quite hard as, let's say, the average user of pain medications such as paracetamol to reach such a state that you would have to go in and receive therapy such as this.